Aicardi syndrome and neuronal linkage. Aicardi syndrome is not only a seizure disorder, it's a rare developmental uh, brain wiring disorder. In this condition, the corpus callosum, the bridge between the right and left hemisphere, is absent or poorly developed. Because of this abnormal neural connection, brain signals become poorly coordinated, leading to infantile spasm, seizures, and developmental delay. The disease also affects the eye, producing characteristics chorioretinal lacunae, and may involve spine and ribs. Hi, my name is Dr. Vyas, and today we're going to discuss Aicardi syndrome. The classic triad include corpus callosum agenesis, infantile spasm, and chorioretinal uh, lacunae. It's a rare congenital developmental disorder. The classic triad includes absent underdeveloped corpus callosum, infantile spasm, seizures, epilepsy, and characteristics chorioretinal lacunae. General description occurs almost exclusively in girls. Rare affected male usually have 47 XXY or mosaicism. Most cases are sporadic and not inherited. Specific causative gene has not been definitely identified, and X-linked dominant mechanism is suspected. Core abnormalities: dysgenesis of corpus callosum, epilepsy, spam, chorioretinal lacunae, and visual impairment might be there. Skeletal finding may include vertebral, ribs anomalies, and scoliosis. Mechanism of disease: early embryonic X-linked error leads to abnormal neuronal development. Corpus callosum agenesis, cortical network malformation, epileptic circuits defects, and developmental impairment. Brain formation: interhemispheric communication becomes reduced. Additional cortical malformation may disturb normal synaptic organization. Seizures biology: excitatory inhibitory balance is disturbed in these kind of patients with this disease. Infantile spasm may evolve into difficult to control epilepsy. Eye brain linkage leads to chorioretinal lacunae, vision impairment, neurodevelopment uh, reduction, ophthalmology, sports important early. Neuronal mechanism: genetic developmental triggers, axonal guidance, and midline crossing defects. Corpus callosum absent or underdeveloped, weak interhemispheric synchronization, which leads to cortical malformation, excess excitability, and infantile spasm, epilepsy development, and cognitive disorders. That's the key point of the neural mechanism. Pathology: the brain pathology is the corpus callosum agenesis, cortical malformation, intracranial cyst or verticulomegaly may occur. Microcephaly and abnormal cortical network develop can contribute to seizures. Ocular pathology: chorioretinal retinal lacunae are highly characteristics. Vision support is important for development and quality of life. Clinical output includes developmental delay, intellectual disability, hypotonia, spasticity, feeding difficulties, scoliosis, and variable severity from severe childhood diseases to survival into adulthood. Diagnosis: MRI, EEG, ophthalmology examination, developmental assessment may play a major role in the diagnostic workup. Differential diagnosis: corpus callosum, agenesis, and other causes, other infantile epileptic encephalopathies, retinal lesions, chromosomal or genetic malformation syndrome, metabolic causes. These are the few differential diagnoses for the Aicardi syndrome. Treatment include the seizure control drugs, especially nowadays, as you know, that ketogenic diet play a major role, as well as other drug therapy for the improvement in uh, epileptic fits, monitor medication, adverse effect, and development. Developmental care, physiotherapy, speech and feeding therapy, communication and swallowing, uh, early intervention, and special education planning, nutrition, sport, and feeding difficulties. Sportive care, ophthalmology, orthopedic care, management of reflux, constipation, and respiratory complication if present. These are the few treatments that can be given to infantile patient uh, and for her development. Treatment goals: reduce seizures, protecting feeding, supporting vision, prevent complications, improve comfort, sleep, participation, and family quality of life. Monitoring, regular pediatric monitoring should be there. Medication review, repeat EEG, ophthalmology, growth, swallowing, nutrition, respiratory monitoring should be there. Spine surveillance for scoliosis. Prognosis factors: severity or control of epilepsy, brain malformation, to which extent brain malformed, degree of visual impairment, respiratory complications, scoliosis, or mobility limitations. Some individuals have severe disease in childhood, others survive into adulthood with variable disability. Expected course: motor and visual impairment can affect daily functioning, outcome in individual, and difficult to predict at diagnosis. That is summary and key messages. It's a rare congenital neurodevelopmental disorder. Classic target is corpus callosum agenesis, dysgenesis, infantile spasm, and chorioretinal lacunae. Neuronal mechanism is abnormal brain wiring. Clinical consequences include seizures, developmental delay, intellectual disability, cognitive disorder, and motor difficulties. Treatment is supportive, like seizure control, rehabilitation, ophthalmology care, feeding, nutrition, and orthopedic care. Prognosis is variable and depends strongly on seizure burden, brain malformation, and systemic complications. Thanks and records. Please like and subscribe this channel for further discussion on different and rare diseases. Thanks.